Okay, I've already done the vital signs on this patient. They are within normal limits. I have also tested cranial nerve 2, the optic nerve, using the Snellen chart, and her vision is 20/20. Hi there, my name is Kylie. I'm going to be your nurse today. I'm just going to provide you some privacy. I'm going to wash my hands and put on my gloves. So today I'm here to do a head-to-toe assessment. I'm going to start at your head and go to your toes, and I'm just going to be touching different places in your body, asking you questions. If you feel any pain, please let me know, okay? Could you please start off with providing me your name and date of birth?
Dima Almashad, June 5th, 2001.
Okay, do you have any allergies I should be made aware of?
No.
Okay, are you in any pain?
No.
Okay, and how's your generalized mood today? How are you feeling?
I feel good.
Good, okay. So can you please tell me your name again?
Dima Almashad,
Do you know what year it is?
2025.
Okay, do you know where you are?
I'm at your house
Okay, and do you know why you're here?
to do a head-to-toe assessment.
Okay, perfect. So we're gonna start with your head. I'm just gonna palpate your head. I'm looking for any edema, any lumps or bumps. No bumps detected. Skin is patent and pink, and skin is warm. I'm also going to check your eyes, so just look straight ahead for me. Okay. Sclera is white and no redness detected. I'm also going to check your ears. I'm just going to pull up and back, okay? Okay, light cerumen is present. Tympanic membrane is translucent and pearly white, and there is no redness. Okay, tympanic membrane is translucent and pearly white. There is light cerumen and no redness. I'm gonna go ahead and check your nose now. Okay, there is no deviated septum, no redness, and no bleeding. All right, can you give me a big smile? Okay, gums are intact, teeth are intact, gums are moist, and there is no bleeding. I'm gonna go ahead and inspect your neck. There's no redness, no edema, which is good. I'm gonna go ahead and feel your trachea. I'm gonna palpate it, and then can you go ahead and swallow for me? Okay, trachea moves upon swallowing. Can you go ahead and face that way for me? I'm just gonna palpate your thyroid.
Oh, do you want me to stand?
That's okay, this is fine. Okay, thyroid is non-palpable. I am gonna go ahead and feel your lymph nodes. So I'm gonna start with your pre-auricular. Okay, post-auricular, retropharyngeal, submandibular, submental, occipital, anterior cervical, posterior cervical, and supraclavicular. Okay, all lymph nodes are non-palpable. Now I'm just gonna listen to your carotid. While I do this, I'm gonna have you hold your breath whenever I tell you, okay? And I'm just listening for any bruits, okay? Go ahead and hold your breath for me. Okay. Go ahead and hold your breath for me. Okay, now I'm just gonna palpate them one at a time. All right, no bruits present. I'm now going to test your cranial nerve. So I already tested your optic nerve. I'm gonna go ahead and start with your olfactory nerve. I have 2 senses here, and what I'm gonna have you do is I'm gonna have you close your eyes and hold one nostril, and I'm gonna place one of these to have you, and I'm gonna have you take a big deep breath and smell it for me and tell me what you smell. So go ahead and close your eyes and hold one nostril. Okay,
Mint.
okay, now the other one.
Lemon.
Okay, perfect. Now I'm gonna test cranial nerves 3, 4, and 6, oculomotor, trochlear, and abducens. So I'm just gonna have you look straight ahead and follow this pen. Okay, you ready? Okay, using the 6 fields of cardinal gaze, Perla is detected. Now I'm just going to test cranial nerve 5, your trigeminal nerve. I'm gonna have you close your eyes, and when you feel my touch, just say touch, okay?
Touch. 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 Touch.
Okay, perfect. Now I'm going to test cranial nerve 7, your facial nerve. Can you give me a big smile? Okay, raise your eyebrows. Puff out your cheeks. Perfect. All right, now I'm just gonna see for any clicking in your temporomandibular joint. Can you move your jaw side to side for me? Okay, no clicking detected. I'm now going to test cranial nerve 8, your vestibulocochlear nerve. Can you go ahead and stand up for me and face that way? Okay, I'm going to stand behind you, and I'm going to whisper something in your ear, or whisper something behind you and tell me what you hear, okay?
Hello.
Okay? And the other side?
Goodbye.
Perfect. Now can you just face this way? And I want you to put your feet together, close your eyes, and just stand there for 1 minute and try and be as still as possible. This is the Romberg test. Okay, thank you. You can go ahead and sit down. Now I'm going to test cranial nerves 9, 10, and 12, your glossopharyngeal, vagus, and hypoglossal nerves. Can you go ahead and open your mouth, stick out your tongue, give me a big ah? Okay, uvula is midline. Can you go ahead and swallow for me? Okay, now I'm just going to test your gag reflex. Open up for me. All right, now I'm just going to test cranial nerve 11, your accessory nerve muscle. Go ahead and shrug your shoulders up and down. Okay, now do it with resistance. Okay, perfect. All cranial nerves are intact. Can you go ahead and stand up for me? I'm just going to test your gait. So what I want you to do is I want you to face that way and heel to toe, walk forward 2 to 3 steps. Now turn around. Okay, gait is within normal limits. You can go ahead and sit down. Now I'm going to test your upper cerebellar. So what I want you to do is I want you to go like this with your hands as fast as you can. Perfect. Now on both sides, I want you to go heel to shin. I want you to start on your heel and go up with both legs for your lower cerebellar. All right, perfect. So now what I'm going to do is I'm going to inspect your chest. Okay, skin is intact. There's no redness and skin is warm. I'm going to go ahead and test for turgor. All right, skin is elastic. Now I'm going to inspect your arms. Can you just put your arms at both sides for me? Okay, arms are symmetrical, no redness, no bruising. I'm going to test your capillary refill. Go ahead and stick your hands out for me. Okay, cap refill is less than 3 seconds. I'm going to test some of your joints. So I'm going to start with your tricep. And I'm going to go to your bicep. And I'm going to go to your brachioradialis. And then your patellar. Okay, I'm going to do it on the other side. Tricep, bicep, brachioradialis, and patellar. Good, your reflexes are good. Now I'm going to have you flex your arms and extend your arms for me. Okay, now try it with resistance. Okay, now try pushing up. Okay, then I'm going to have you abduct and then adduct. Okay, now do it with resistance. Push in and push out. Okay, good. Now I'm just going to listen to your heart. I am going to start with your right second intercostal space, your aortic valve. Just breathe normally for me. All right, left intercostal space, the pulmonic valve. And I'm going to use my bell to the third intercostal space for Erb's point. Okay, then I'm going to go to the fourth left intercostal space, the tricuspid valve. Okay, can you lean 45 degrees for me? I'm testing your fifth intercostal space, with your mind, your apical valve, and I'm going to do this for 1 minute. Okay, now while I'm here, I'm just going to listen to your apical valve while I palpate your carotid. Okay, perfect. Now what I want you to do now is I want you to lean back 45 degrees and look that way. I'm looking for any JVD. Okay, now the other side. No JVD present. And then go ahead and just sit normally. Okay, there's no barrel chest, respiratory rate is unlabored, and chest rises and falls evenly. So now I'm going to listen to your lungs. I'm just going to ask you to take some deep breaths for me, okay? You ready? Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Okay, deep breath. Deep breath. And deep breath. Deep breath. Okay, can you lean forward for me? I'm going to listen to your back. Deep breath for me. Deep breath. Deep breath. Deep breath. breath, and deep breath. Okay, breath sounds are equal and normal. Now I'm just gonna put my hands under your chest. Okay, using the butterfly hand movement, and then if you can go ahead and sit up for me, I'll just sit back. Same with the back. Okay, all lobes are within normal limits. Now, I'm just going to listen to your abdomen, so if you can go ahead and lay down for me. And I would have done all of that on bare skin. This part as well, I'm going to be doing on bare skin. Okay, so I'm just going to inspect. Umbilicus is midline, chest or stomach is flat, and there's no edema, and skin is intact, no redness or bruising. Now I'm just going to listen on the bare skin. I'm going to start in the right lower quadrant. Right upper quadrant, left upper quadrant, and left lower quadrant. Alright, active bowel sounds and no abdominal roots present. Now I'm just going to percuss. I'm going to lightly tap. If you feel any pain, let me know. Okay, so going right upper quadrant, left upper quadrant, or right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Did you feel any pain? No. Okay, now I'm going to lightly palpate. Right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Any pain?
No.
And how have your bowel movements been?
Good.
Okay, perfect. Now I'm just going to inspect the legs. Legs are symmetrical. There's no redness or edema, no assistant devices needed. I'm going to test your range of motion. So can you go ahead and put your knee to your chest? Okay, down. Again. And then can you go like this for me? As much as you can. Catch, okay? Perfect, okay. Now can you point your toes? Okay, now can you do that while I resist? Okay, perfect. So you have full range of motion and full strength. I'm going to go ahead and test your posterior tibialis heart rate. +2 equal bilaterally. And I'm going to test your dorsalis pedalis +2 bilateral. Okay, and I'm also going to, while I'm here, test your radial again. +2 equal and bilateral. And I'm going to test your brachial. +2 equal and bilateral. Now the patient does have white nail polish on her toes. So normally I would use a different toe, but I'm going to assess cap refill. And it is less than 3 seconds.